So I'm often asked, does multiple sclerosis actually present in childhood? And unfortunately, the answer is yes. We know from large studies that somewhere between 2 and 5% of all patients with multiple sclerosis present when they're less than 18 years old. Now, this is still a small number, but it's important for the patients, obviously, that are diagnosed as children for many reasons. So I'll tell you a little bit about some of the similarities to adult onset MS, some of the differences, and then some of the work that we're doing here at the Rocky Mountain MS Center to better understand this population. So, as I mentioned, it's a small population, 2 to 5% of all multiple sclerosis patients. Most of them present in their teenage years, but we do rarely see kids present as young as 7, which is the youngest that I've diagnosed. And here at the Rocky Mountain MS Center, we see about 50 kids. This is a difficult diagnosis to make in many respects, which is one of the differences with adult onset MS, is that when a child presents with a neurologic symptom, something has changed in their nervous system, we have to think about a much different list of possibilities that it could be. And MS is one of them, but others include disorders that only present in childhood that we wouldn't think about with a patient presenting in adulthood. So one of those diagnoses is called acute disseminated encephalomyelitis. And this is a one-time disorder. So it just happens once and does not recur throughout life. So obviously, this is an important distinction to make. Does the child have an ongoing disease like multiple sclerosis, or is it acute disseminated encephalomyelitis, a disorder that's only going to happen once? And this is difficult to differentiate clinically. So we have many tools that we use to help us. We have the MRI, we have the patient's history, we have laboratory studies that we do, and all of these help us to make the diagnosis. But there are some differences to adult onset MS. Namely, the MRIs appear different in childhood. The lesions may be larger, they may be diffuse. They tend to happen in parts of the brain where it's less likely in adult onset MS. We also know that children with multiple sclerosis have a very inflammatory disease, meaning early in the course of their disease, they have a lot of activity, up to 3 times as much per year than adults do. So this makes it very important to diagnose it early and get the right treatment started. Now, prognosis. This is something that I'm asked often, and it's a good question, and it's something that we're learning more and more about. Namely, what does this mean for the child who's diagnosed with MS? What does it mean for them in the next few years? What does it mean for them when they're 20, 30, 40, and so forth? What we have thought in the past is that because kids tend to recover so well acutely, that the disease was somehow benign, that it wasn't as severe. We know now that that's not the case. Although kids recover from their exacerbations pretty well in the short term, just like adults, the disability can accrue over time, meaning that we see that every exacerbation counts. And when kids are diagnosed in childhood, that means that they have the disorder that much longer than an adult would. We know from some natural history studies done in France that kids will reach a level of disability sooner than adults will. So what we're doing here at the Rocky Mountain MS Center is we have put together a multidisciplinary clinic that is comprised of me, a neuropsychologist, a psychologist, a social worker, a pediatric neurology nurse, as well as representation from the Rocky Mountain MS Center and the National MS Society. And it's our hope that by bringing all of these services to these kids that we'll be addressing all of their needs as they go forward.